Welcome back to Open Line. Talking with Dr. Shawn Joseph, Director of Metro Schools. Focus really on the budget. Something that has concerned a lot of people, free and reduced lunch.
Yeah.
That program is being scaled back. Why is that happening?
That's a great question, and thank you for asking. So 4 years ago, Metro Nashville Public Schools received a federal grant, and the federal grant allowed 100% of our schools to get free breakfast and free lunch, because we were at 61% of our schools free and reduced meals. 4 years later, our direct certification program, meaning families that apply to get food stamps or the equivalent, dropped from 61% to 47%. So we no longer qualify to have 100% of our schools participate anymore in that federal grant. You can reapply every year, but this year, at the time of the reapplying process, we're not able to, because we're below the 60% that's required for the full district. So what's going to happen now is we have about 74 schools that do qualify. Their poverty levels are high enough for 100% of the students to receive free and reduced meals for breakfast and lunch. But for those other schools that we have within the district, they still will get free breakfast, but for the free lunch, they're going to have to fill out the forms that they used to fill out 4 years prior. And for those students that qualify, will still receive lunch. Now, we're very concerned about that, because we know we have lots of families who don't participate in the direct certification program. We're really concerned because we have a large immigrant population within Metro Nashville Public Schools, and those families won't apply, might not qualify to apply. And we also have families who just might not know how to go about applying to be a part of the process. So we're going to have a huge communications process to make sure that families know their rights, and we encourage them to fill out the forms and get the forms turned into us in those schools that will not qualify. So it's about half of our schools that won't qualify, half of them will get it. But that's—
Would you consider asking the council? You're going to have to make a budget request to the council.
Yes.
Would you consider a line item in there? Maybe it's $8 million, whatever the amount might be. Is that right? Would it be $8 million?
It's about $8 million, yes.
Would you consider a line item in there to make that situation whole?
I would consider that, and I think the board is going to want to talk about that and consider that as well. What I'm hearing is that this is going to be a very difficult budget season. I mean, I have a $45 million request out there now. Our big goal, though, so right now in my children's schools, they're able to get free breakfast and free lunch. But under the new guidelines, they will not qualify. I would have to pay. I wouldn't fill out the paperwork, because as a family, we would not qualify. But a family in a school that does not have it, that is under the poverty line, will be able to receive it. They'll have to fill out the paperwork, though. So the question becomes, and that's something the board has to discuss, is it important for families like my daughter and my son, who I could pay for them to get lunch. Even though they get free lunch now, they prefer to just bring a bagged lunch. Do you do something and pay for them automatically? Or do you work to make sure that every family who should get it does get it, by making sure we fill out the paperwork and communicate with people? That's a conversation that we need to have. But $8 million of taxpayer dollars is a lot. We want to make sure our kids are fed. Everybody will get breakfast. So it's a matter of that lunch and what we can do. So we'll talk about it. And my commitment will be, any kid, and it's always been the case, any kid who comes and doesn't have money but needs to eat, will eat. We ultimately just charge the school that cost, and then of course the school would have to pay for it, and we'll work with those schools on that. But
in the budget that you just presented,
yes,
it's cutting several positions. One that I've heard concern about is trained social workers. You're
yes,
cutting 7 trained social workers.
Yes.
Big push has been social emotional learning.
Absolutely.
So how do you cut social workers when that's a big focus?
Yeah. So we had to make tough decisions in terms of how much we're going to ask for. When we meet with our groups, I had at least $80 million worth of legitimate asks. But we have to decide what's a reasonable amount. And we thought a 5.1% increase was still a lot to ask for. But as we looked at the social emotional learning area, we actually are repurposing and refocusing the entire program. Actually, at tomorrow's budget meeting, Dr. Tony Majors will talk in more detail about how we're still covering those supports, but we're putting in, I believe, 3 more additional $1 million towards social emotional learning. Now we're going to be we're proposing to add 18 community in schools. So those are 18 social workers that work in those schools. Now the difference is those social workers are not clinical social workers, so they're not doing the mental health supports and things of that nature. They help families coordinate those supports. But we believe we can, even though we're losing 7 positions, we have some schools that don't have any social work services, meaning they don't have any referrals, and we have some that have a lot. We believe with the social workers that we still will have in the school district, we can realign and be fiscally responsible and not overwhelm people as we include additional supports. I mean, one of the things we did in the school district is to divide our school district into 4 different quadrants. Within those 4 quadrants, we're putting in teams to support the training of teachers and the support of kids, where next year we'll have at least 3,000 teachers trained in some sort of social emotional learning model. We've added additional behavior specialists, and we've added some truancy specialists within the budget. So
teachers are going to be trained in some cases to offset. At least that's your hope.
No one can do what a clinical, they won't be able to do what a clinical social worker can do. I mean, that is a specialized training that those teachers won't have. But we think we can utilize the social workers that we have in key areas to still provide adequate services and continue to work with external partners like we have worked with to meet the needs of students. But what we're proposing will dramatically enhance overall wraparound supports within the district. We feel confident about that.
All right, we're going to take a break, come back with more questions. Take a break, be back right after this.
Yeah.